Longani Clinic's YouTube channel welcomes all of you. Today we are going to study the kidney stones and homeopathic treatment or renal calculi and homeopathic treatment. First we will see the introduction part. Kidney stones are hard deposits of minerals and salts that forms inside the kidneys. They can range in size from a grain of sand to a golf ball and can cause severe pain and discomfort as they travel through the urinary tract. The common symptoms of kidney stones includes intense pain in the back or side, nausea, vomiting and blood in the urine, hematuria. Risk factors for developing kidney stones includes dehydration, family history of kidney stones, certain medical conditions, and a diet high in salt and sugar. Treatment options for kidney stones depends on the size and location of the stone. It may include medication to manage the pain and inflammation, drinking plenty of water to help flush out the stones, homeopathic treatment and surgical intervention in more severe cases. Types of kidney stones now we will see. There are several types of kidney stones and the composition of the stone can affect the treatment and prevention approach. Here are the most common types of stones we will see. First one is a calcium stones. These are the most common type of kidney stones and are composed mainly of calcium oxalate. They may form due to the high level of calcium and oxalates in the urine. Second one, struvite type of stones. These stones can form as a result of an infection in the urinary tract. They can grow quickly and can become quite large if left untreated. Third one is the uric acid stones. These stones can form when the urine is too acidic. They may also form in people with gout or those who eat a diet high in proteins. The fourth one is a cystine stones. These are rare and are caused by an inherited disorder that causes the kidney to excrete too much of certain amino acids. The fifth type is xanthine type of stones. They are very, or you can say they are little rare. They are smooth and round, brick red in color. Identifying the type of kidney stone can help determine the cause of the stone and the most appropriate treatment approach. Now we see what are the investigations is to be done. The first one is a blood test. May reveal too much of calcium or uric acid in your blood. Second one, radiography, plain X-ray abdomen KUB helps to diagnose 90% of the kidney stones. Third, IVP, intravenous pyelography. This helps to locate the stone exactly in relation to kidney and ureter and to assess the renal function. A radiolucent stone can be seen as a filling defect. Hydronephrosis can also be made out. Fourth one, USG, ultrasonography, is the most valuable to diagnose the stone, its size and exact location. It also confirms the enlarged kidney. Fifth one, high speed or dual energy computerized tomography CT may reveal even the tiny stones. Then comes the urine culture and sensitivity. Then comes the investigations of renal functions, blood examination for urea, creatinine clearance, etc. to rule out the renal failure or renal function. Eighth one is an investigation to determine underlying causes, plasma calcium, phosphate, parathermal, plasma urate, 24-hour urine. So these are the routine tests you should do. Then comes the stone analysis of any stone that has been passed. Now we see the diet for kidney stone. Dietary changes can help reduce the risk of developing kidney stones as well as help manage existing stones. Here are some dietary instructions for kidney stone. First, stay hydrated. Drink plenty of water throughout the day to help dilute the urine and prevent the formation of kidney stone. Aim for at least 2 to 3 liters or more of water per day. Second one, limit sodium intake. High level of sodium in the diet can increase the risk of developing kidney stones. Limit your intake of processed foods, canned foods and fast food which tend to be high in sodium. Third, reduce animal protein. Diet high in animal protein such as meat, poultry and fish can increase the risk of developing kidney stones. Consider limiting your intake of animal protein and choosing plant-based protein sources such as beans, lentils and tofu. Fourth one, moderate calcium intake. Calcium is an important nutrient for bone health, but high level of calcium in the urine can contribute to the formation of kidney stones. Aim for moderate intake of calcium through foods such as low-fat dairy products and leafy greens. Avoid high oxalate food. Oxalates is a substance found in some foods that can contribute to the formation of kidney stone. Avoid or limit high oxalate foods such as spinach, rhubarb, beets, nuts and chocolate. Now we will see the homeopathic approach towards the kidney stone or renal calculi. Homeopathy is a form of alternative medicine that uses highly diluted substances to stimulate the body's natural healing abilities. Homeopathic remedies for kidney stones are highly individualized and vary depending on the person's unique symptoms and characteristics. Now we will see the few remedies, or we will see the few common remedies and uncommon remedies used for the kidney stones. The first one we will see is a Calcarea cow. Calcarea cow is a homeopathic medicine that is commonly used for the treatment of kidney stones. It is a mineral-based remedy that is prepared from the inner layer of oyster shell. Calcarea cow is believed to help with kidney stones by reducing the size and frequency of the stones and alleviating the associated pain and discomfort. It is also thought to help prevent the formation of new stones. What is the constitution of Calcarea cow? This medicine is generally indicated in leucophlegmatic and scrofulous individuals, blonde hairs, light complexion, blue eyes, fair skin, tendency to grow fat. Physical symptoms of Calcarea cow: head sweats profusely while sleeping, wetting the pillow. Another medicines are Silicea and Sanicula. Aggravation of Calcarea cow: cool air aggravation, wet weather aggravation, cold water aggravation, full moon aggravation. Now we see the second medicine is a Lycopodium. The gastrointestinal and urinary symptoms are prominent. Renal colic. Right side is more affected. Left side kidney stone, the medicines are Berberis and Tabacum. Red sand in the urine. Child cries before urinating. Another medicine is Borax. The constitution of Lycopodium: intellectually keen but physically weak. Upper part of the body is emaciated, lower part is semi-dropsical, suited to extremes of life, children and old people. The aggravating time 4 to 8 p.m. Amelioration by warm foods and drinks. Uncovering the head, loosening the garments. Associated complaints are excessive accumulation of flatulence, loud grumbling, especially lower abdomen. Upper abdomen is carbovage. Entire abdomen is cinchona, means China. The third medicine is the acid nitric. Calculi in the urine due to oxalic acid, and when oxalic acid is the main ingredient of the calculi, urine has a strong smell like horse urine. Cold when it passes. Complaints after continued loss of sleep, overexertion of mind and body. The constitution of nitric acid suited to thin person of rigid fiber, dark complexion, black hair and eyes, the brunette rather than the blonde. Mugsol is light-haired person. Nervous temperament. Next medicine is sarsaparilla. Severe, almost unbearable pain at the conclusion of urination. Another medicines are berberis, equisetum, medorinum and thuja. Passage of gravel or small calculi, renal colic, stone in bladder, bloody urine, sand in urine or on diaper, child screams before and while passing it. Another medicines are borax and lycopodium. Now see the next medicine is a hydrangea, a remedy for gravel, profuse deposit of white amorphous salts in the urine, sharp pain in loin, especially left side. Good medicine for enlarged prostate. Another medicine for prostate are ferrum pick, sabal cerulata. Great thirst with abdominal symptoms and enlarged prostate. Next medicine you will see is a Parira brava, useful in renal colic, prostate affections and catarrh of the bladder, pain down the thigh during efforts to urinate, dribbling after micturition. Another medicine is selenium, can emit urine only when he goes on his knees, pressing head firmly against the floor. Most commonly used medicine now we'll see is a Berberis vulgaris. It is one of the prominent homeopathic medicine for the kidney stone treatment, mainly for the left side of the kidney. Osimum is for the right side. Stitching, cutting pain from left kidney, following courses of ureter into the bladder and urethra. Another medicine is tabacum, right kidney lycopodium. Even useful for colic from gallstones also. Now we'll see the next medicine is a cantharis. It's called as Spanish fly. Indicated for kidney stones of both the sides when burning sensation is the main keynote. Burning micturition which is passed drop by drop. Intense burning sensation before and while passing the urine that continues after the urination. There is also a constant urge to pass the urine, but little urine is passed, blood in the urine with much scalding, violent sharp tearing pain in the kidneys you will find. Then tenesmus of bladder may also be a mark whether or where the urge to pass the urine is almost constant, together with unsatisfactory urination. Urine may contain jelly-like mucus. Next medicine is Urtica urens. Urtica urens must be considered in cases of renal stones where uric acid levels are high. Next medicine is a Hedioma, pennyroyal, dull burning pain over the left kidney, pain along the left ureter. Next medicine uses a Apigia, repens, trailing arbutus, renal calculi, gravel, fine sand in the urine of brown color, mucus and uric acid deposits, pylitis, incontinence of the urine. Next medicine is a Eupatorium purpureum, vesical irritability in human, irritable bladder it is called as. Next medicine is Thraspi bursa pastoris, that is called as shepherd's purse, renal colic, brick dust or brick dust sediment, dysuria and spasmodic retention. It is an anti-hemorrhagic and anti-uric acid remedy. Urine runs away in little jets, often replaces the use of catheter. Craves buttermilk is a symptom. Useful for gynec cases. Scarcely recovers from one period before the another begins. Next medicine is oxydendron, that is called as sorrel tree, vesical calculi, irritation at neck of bladder, urine suppress, dropsy, prostatic enlargement. Next medicine is solidago virga, that is called as golden rod, urine scanty, reddish, brown, thick sediment, dysuria, gravel. Sometimes it makes the use of catheter unnecessary. Urine clear and offensive. Next medicine is stigmata M, that is called as corn silk, renal lithiasis, nephrotic colic, blood and red sand urine, suppression and retention of urine, urinary symptoms associated with organic heart disease. Next medicine is Phyllanthus neruri, stone breaker medicine. Has a long history in traditional herbal medicine in every tropical country. It is found in the clinically beneficial effects. Phyllanthus may be related to urethral relaxation, helping to eliminate calculi or to clear fragments following lithotripsy. Next medicine is Crotavia neruvala, inhibits the formation of stones and it is a diuretic. It increases the tone of the bladder and prevents the formation of stone. Next medicine is Calcarea renalis, gravel and renal calculi, lessens the tendency for stone formation. Next medicine is a Polygonum persicaria. It is also useful for renal colic and calculi. Then next medicine is Piperzinum, urinary calculi, uric acid diathesis, constant backache, urine is scanty, rheumatic urethritis. Next medicine is a benzoic acid. Best homeopathic medicine for renal calculi with strong odor of urine with gouty and rheumatic diathesis. Next medicine is Uva ursi, bearberry, medicine for cystitis with bloody urine, medicine for dysuria and strangury when the urine contains pus and blood, calculus inflammation, green color urine. Next medicine is a tabacum prepared from tobacco, renal colic, violent spasmodic pain along the ureter, mainly the left side like berberis. Next medicine is a lithium calf, pain in the region of right kidney while urinating, pressure in the heart. Next medicine is a benzoic acid, urine dark brown and the urinous odor highly intensified, excess of uric acid you will find. Next medicine is Ocimum can, Brazilian alfavaca, renal colic especially right side, urine has a odor of musk, red sand in the urine. Now we will see the miasmatic approach. The miasmatic approach is a concept in homeopathy that refers to the underlying predisposition or susceptibility of a person to develop a particular disease or condition. According to this approach, certain miasms or inherited predispositions can make a person more susceptible to developing kidney stones. Here are most commonly discussed miasms in relation to the kidney stone. First one is a psoric miasm. This miasm is associated with a tendency to develop acidic conditions in the body. It is often associated with history of overeating, consumption of acidic foods, and a sedentary lifestyle. People with this miasm may be more susceptible to uric acid stones. The second miasm is a psychotic miasm. This miasm is associated with tendency to develop inflammation and swelling in the body. It is often associated with history of eating fatty or oily foods and a tendency towards the constipation. People with this miasm may be more susceptible to calcium oxalate stones. The third one is a tubercular miasm. This miasm is associated with a tendency to develop infections in the body. It is often associated with the history of respiratory illnesses and a tendency towards dehydration. People with this miasm may be more susceptible to struvite stones. A qualified homeopathic practitioner may take a miasmatic approach in determining the underlying susceptibility of a person to kidney stones and selecting the appropriate homeopathic remedy based on the individual's overall symptoms and characteristics. It is important to note that the miasmatic approach is just one aspect of the overall homeopathic treatment, and other factors such as individual's lifestyle, medical history may also be considered. Now we will see the concluding part or the conclusion. It is important to note that homeopathic remedies are highly individualized, meaning that the remedy prescribed will depend on the individual's specific symptoms and overall health. It is recommended to consult a qualified homeopathic practitioner for proper diagnosis and treatment of the kidney stones. However, it is important to note that kidney stones can be serious medical condition, and it is important to seek prompt medical attention if you suspect you have a kidney stone. In some cases, surgical intervention may be necessary to remove the stones. Thank you.